Welcome to Your City on Community 7 Television. I'm Schutz Wies and I'm your host. Each month we look at a different aspect of what's going on in the city of Billings. This month we're going to do a very timely program on the COVID-19 pandemic outbreak. We're very lucky to have Mayor Bill Cole with us, City Administrator Chris Kukulski with us. Gentlemen, thank you for being here. Talk to us a little bit about the city's response to the COVID-19 pandemic. So thank you for being here.
Thank you.
All right. Let's get started with this question to you, Mayor Cole. Kind of give us an overview, 30,000-foot view of what is the city's role in response to the pandemic? Where does the city government fit into the complete response to the pandemic?
Well, Schutz, as you know, and as everybody watching this knows, this has been an incredibly dynamic, fast-moving series of events. The city has been responding very well, and by saying city, I mean the entire city, every aspect of it, not just city government, but our healthcare providers, the county government, our city health department, which is Riverstone Health, the individual citizens, everybody has been responding very, very well. The city's role is to protect the health and safety of our citizens. And we've done that with in lots of ways, giving our first responders the support that they need, but also just going about our day-to-day work. We still need to provide sewer and water services. We still need to keep the doors of government functioning. City Council still needs to meet. So we're working very hard with our dedicated employees to keep government operating. And so far, so good. We've been very blessed to have the gift of time. We're coming into this at the tail end of the rest of our country, which has given us an awful lot of knowledge, and we've been able to implement measures sooner than happened in a lot of the rest of the country, and that's allowed us to reduce the amount of infections, and so we're very fortunate.
All right. Chris, talk to us a little bit about how does the city fit in with Riverstone Health? What is Riverstone Health? How does the city fit into it? Maybe a little bit about the Unified Health Command. Walk us through that structure a little bit.
So Riverstone Health is kind of at its core the city-county health department. So it is the city, both local units of government coming together to provide health services. In a situation like this, it's blessed with Unified Health Command made up of St. Vincent's Healthcare, Billings Clinic, Riverstone Health, and then the city-county disaster emergency relief operator. So those four entities are all guiding our chief health officer, John Felton, who is the CEO of Riverstone Health.
Okay, all right. And Mayor, give us a sense for, what services in the city have been affected? What's been affected the most? What services does the city provide that have been under the most strain during this time?
It's hard to rank, and so I'll try to avoid that. The reality is that every department in city government has been significantly affected. First, we're very focused, of course, on our first responders. We want to keep them healthy and safe, and so far that's the case. But our library, for example, closed early in this process, and we were able to make the library available as a daycare facility for healthcare workers and families of first responders. But it doesn't stop there. The airport, our Met Transit system, still needs to function, and so they're taking special measures to have social distancing, to provide hand sanitizers. We're trying to send workers home if they can work from home. Right down to the finance department, to the city council. We'll be meeting remotely. You can't rank it because everybody's been affected, just like everybody in our community.
Sure, absolutely. Chris, walk us through, take us back, maybe a couple weeks, a month. I don't know, when did you guys start planning for this, and kind of walk us through that planning process to where we are today?
So thankfully, your first responders and Riverstone Health, they literally have been planning for these types of things for years. It was a reminder to me as I kind of looked it up. It was 2009 that the country last had a pandemic. So though most of us don't think of these things, I can assure you John Felton and the hospitals, they've been thinking about planning for and preparing for these literally for years. Now, what I would say specific to COVID-19, it's really been the last probably 30 to 60 days that it really, as things were evolving in Asia and making their way into Europe, that it was clear this is going to be something that's going to hit us a little more quickly than, frankly, we would have liked, and it was time to get moving.
Shoots, could I add one
Sure,
thing
please
that
do.
I
Absolutely.
think is very important, and that's the existence of our local emergency planning committee, the LEPC. Most people in the community don't realize that every month we have a meeting of local emergency planners, and that began far before there was anybody ever heard of COVID-19. That's been going on for years and years and years. Now, I'm not going to tell you that that group was fully expecting this pandemic, but they fully were expecting floods, earthquakes, overturned trucks on the highway, a whole list, including pandemic or rapidly transmitted disease. And so those are part of the planning mechanisms that group comes to talk about every month. And it's a group of about 30 to 40 people. When I first took office, I knew that was an area that I knew almost nothing about. So I've tried to prioritize my attendance at those meetings so that I can learn who the people are, and that's been a great confidence builder because I know that infrastructure has always been in place, and and they've now meeting on a regular basis, and people need to know that have that confidence.
Right. So, yes, they're meeting once a month. Something like this happens. Are they meeting daily, weekly? Where are they at now?
Yeah, that will be ultimately up to our disaster emergency services coordinator and his group. They'll set that schedule. You're right, it'll be on a very frequent basis as they determine. The monthly meetings were just the regular meetings when there was no emergency at all. I would anticipate, it depends what they see as their needs. Right now, this is largely being handled out of Riverstone Health, but I imagine they'll be getting together more than once a week.
All right.
In fact, the piece I would add to that, Unified Health Command's meeting at a minimum 3 days a week, three times a week. And what I've seen over my career is if you wait until the emergency for these people to begin to collaborate together, it doesn't work. And so they're collaborating every day on the basic emergency, right? When someone dials 911 and they have a health emergency, AMR, the fire department, often the police department, and our hospitals are working together. This is just scaled up, beyond what we ever could imagine. But thankfully, those relationships, all that planning, really does start to pay off during these times, because if it didn't exist, you'd see immediate kind of breakdowns in lack of trust, confidence, people kind of fighting for power and authority, and that's not what's happening.
Sure.
Billings Clinic, St. Vincent, Riverstone Health, 3 medical components of that Unified Health Command, they have their own incident command structure, and they're meeting twice a day internally in each of those organizations. So a lot of people are devoting their entire time every day, even including the weekends, to addressing this health crisis.
Sure. You mentioned this earlier, Mayor, that Montana has kind of been on the tail end of this. Have you guys either one of you been able to reach out to colleagues on the coast where this has been in place for a while and say, what did you do right, what did you do wrong, and what can we do better?
I have not on the coast. But I have been on the phone in the last several days with mayors of other cities, major cities in Montana, to compare notes a little bit about their response. We can learn from each other and help each other because we're all in this together.
So we have a team of librarians. So as the mayor mentioned, first thing that got closed was a library to shift that purpose. Our library director, and he's got a team of librarians who are researching just those things, and they're feeding us information of what they're seeing in other parts of the country and in other parts of the world to respond. So it's been very helpful.
Now, I know we talked about the fact that this has been responded by throughout the city government. But I think probably most people are firstly going to say, well, this is going to affect the fire department and this is going to affect the police department. What has been the impact on those 2 departments?
So far, probably the most intense thing we are preparing for is as the pandemic ramps up, how will we function at truly minimal staffing? And I would tell you, 911 dispatch is actually just as high on the list as police and fire, water, wastewater, and solid waste, and maybe MET. Though if I had to, I wouldn't rank them, but those would be the first ones that are high on the list. And those department directors with their teams are looking at truly how low can we go? How can we function with single digits, for the water, wastewater, some of those other services?
Are they doing anything like at the 911 dispatch center to reach out to people who maybe worked there before and could come back, and those type of things?
Actually, we've got a couple just recently transferred out of 911 into other departments, and yes, they're on the first call back. I would tell you, and this is an opportunity, if someone is interested in a job, they've always been challenging to fill those positions, but what an opportunity to make a difference in your community. And frankly, during these times, I'm hoping we can find some folks who maybe want to move into a role like this, get trained, and be a 911 operator into the future. So part of what we hope maybe be some silver lining out of a difficult situation.
We've got some really dedicated city employees during when we had so much snow, not this year, but the year before. We had salaried workers who were working 24 days straight without any sort of break. And they never really received any additional compensation for that. They were just dedicated, and people didn't even know about it. So the city is out there working for its citizens.
Sure. Chris, are you shifting any resources maybe to some of those departments that maybe not as hard hit, let's say Parks and Recs, maybe?
Yep, absolutely.
That some of those employees can help out with the police department or the fire department. Walk us through that and what some of those things
So
might
I keep using the library because it was the biggest, right? I think we have about 35 full-time folks there. So we've got a team of 10 who are kind of researching, helping us for some of the things we talked about, and those other 25 are being dispersed, some of those to other departments to help out. And then we're looking at what if we needed to scale them up and train them for other roles, and that's the kind of effort that's coming in these upcoming weeks.
All right. And then last one on this, what has been specific, I think the fire department, obvious what the strain is on them, but the police department, what kind of strains are they seeing out there? I know they're going to be on the tip of the spear of this, but what are they responding to when they go out?
So, I think it really is those 911 calls and being prepared to handle and assist people in their time of need. And our concern as school closures go on, the next risk is childcare, so that's where the tilt-up was important. We realize today is not the peak, right? This is where this advantage of being in Montana really is, seeing what now is happening in the metropolitan areas in our country, so that we can keep particularly the police officers and firefighters able to scale up and minimize 30 days, 40 days straight, if right now we can pace it to prepare for harder times kind of to come, and that's what we're doing.
All right.
This has implications for public safety. There's no doubt about that. Just yesterday, the county announced the release of nonviolent offenders from the county detention facility. Those are just the realities. We don't want this disease spreading rampant through the jail if it can be avoided, and that was a decision that they made. But that could have ramifications. So our need for the police officers never goes away.
Sure. I know Mayor, you've been going to the local emergency planning commission, but what do you see as the role of the mayor and the city council during the course of this pandemic? What is your role in the community while this is going on?
Yeah, we have two roles. One is to keep doing what we've always been doing. The wheels of government need to keep moving. That means we need to be having those council meetings. We need to be doing everything we were doing before. But especially for the mayor, I have a role to do interviews like this, to get the message out to our community. to reassure people, but also to let people know that this is very serious. They need to be washing their hands. They need to be maintaining that social distance. Even here today, within our limited space, we moved everything out as far as we could. This is the real deal, and if we can prevent the transmission in our community, we can protect our older and most vulnerable. We can also bring this to an end as quickly as possible and get our economy back going. So conducting that messaging, working with Chris. We're lucky to have Chris and his crew and great city employees.
All right. And Chris, what's the role of the city administrator during the course of this pandemic?
It really is to facilitate the collaboration between the departments and between other organizations. So in this case, we've talked about it's not just city departments. We got city, we got county, we got private, we got not-for-profit. So for me, it really is making sure that we're collaborating together, I'm understanding what the community need is, and that we're plugging in our resources where they fit. And as we've also talked about, where we have folks who are non-essential, they're stepping up, volunteering, and supporting those essential services. And we need to keep that working well.
And I just add one other thing, role that I play and Chris play is acting as a bit of a liaison with that Unified Health Command. Mm-hmm. So I've been attending Unified Health Command meetings. I reach out, I speak with, and as does Chris, with our county health officer, trying to get an idea of what might be coming down the pike, how the city can help and prepare for changes in those health orders. I also get, as does Chris, several hundred emails a day, sure. As you can imagine, yeah. Phone calls, trying to communicate with our public. Gave blood yesterday. There's these unexpected ramifications that people can't always anticipate. For example, we have a real blood crisis in our community right now because people are not giving blood. About 50% of the blood in our community is given through blood drives, which are large groups brought together, and people are very hesitant to do that. Blood drives are critical care. They're accepted from any of those orders. They take special precautions. They are not a dangerous environment. People need to, if they see a blood drive, participate or go to Vitalant or go on and make a reservation at bloodheroes.com mm-hmm. and give blood, because we've only got in good times about 4-day supply of blood, sure. And now we're down to less than 2 days. So those needs continue.
Maybe we can run that blood bank down at the line at Costco in the morning.
Yeah. and if you give blood, you get a hand sanitizer or a roll of toilet paper.
There you go. There we go. We'll have to start thinking out of the box a little bit. You talked a little bit about going to that Unified Health Command. Walk us through the discussion that you guys had with the library. Obviously, it's going to close. And you were saying earlier that, John Felton got a hold of you. Walk us through that process to where the library is going to close to now it's going to be here for essential services. Kids aren't going to be school. Walk us through that whole process.
Well, a lot comes to kids, doesn't it? Mm-hmm. And taking care of kids is critical to keeping our critical care healthcare workers and first responders on the front line. If they have to be home watching the kids, they can't be at work. And so Billings Clinic, St. V's recognized that immediately, reached out. I got a phone call over the weekend from administration of Billings Clinic, reached out to St. Vincent, and to the credit of our Gavin Wolcher, our library director, and Chris, we made that happen within just over 24 hours, and it's working well. Schools, of course, the city is not in control of schools, but we do try to stay in communication with the superintendent, Greg Upham, and now we have a statewide school closure order. We don't know if that will be lifted, but there's no doubt that has big ramifications for everybody.
All right. And so talk to us about what's going on down at the library, who's watching the kids, who can bring their kids. Give us some of the details of that.
This was such a blessing to the city, frankly. Though we had to give up the facility, the hospitals are in such a better position than the city was to open a child care facility. So these children nurses are at the front door. We're making sure everybody is healthy. It's being staffed at this point by the 2 medical facilities in town. And like I said, that was just such a blessing to us because we knew that first hit would be to our first responders in childcare. So that really was an answer to helping us move in the right direction just in the first 24 hours of things really hitting the ground reality here in Montana.
And they have great protocols to protect the safety of the children and the workers there. I went over to the library the other day. Parents aren't allowed in, people aren't allowed in. You have to have a reason to even come and drop off your child. If you go anywhere, you have to have your temperature taken. It's well staffed by nurses. They're very attentive. So that's really important. We'll be looking for other facilities, or the hospitals will be looking for other facilities as well. We want to spread those kids out. We don't want them all in one place by any means, and the city will cooperate in making other facilities available from the city to the extent that they're needed.
All right. Chris, talk to us a little bit about, I'm sure one of the very first things that had to go away were senior citizen services.
Yes.
What senior citizen services does the city usually provide? When did those go away? And what are you are you able to do anything to replace that, I guess?
So in the short term, unfortunately, the senior center did close. There were events there, activities for seniors, exercise classes, programs of that nature. So all of those, with the closures of any group activities, those ended last weekend.
Okay.
The meals program, the lunch meals program, that's provided by a senior group in town. They chose, I think, about midweek to stop that program. And so now our concern is that facility being cleaned, prepared for a secondary use, and our seniors out there, right? This was a way for them to interact with each other, help their mental health. And so I think as we're, social distancing, don't forget about your neighbors. Don't forget about those seniors. Skype, find a way to video conference, pick up the phone, call, and just check on not only your loved ones, but neighbors that you have in your community who might really appreciate a voice during these times. So part of what that Park and Rec staff is working on is what are some of those kind of activities that the typical spring programs are going to look a lot different than they did in the past. Who knows what they'll come up with as ways to help.
There's another very vulnerable population in our community in addition to our senior citizens, and that's our homeless population. And we're still wrestling with what impact this is going to have. I was in communication with Matt Lundgren, the Executive Director of the Montana Rescue Mission, yesterday, and they're struggling because they don't have the staff, they don't always have the space, they don't have the money, and so they're looking for help financially. And it's not just the rescue mission, but other service providers like the Hub, the Mental Health Center here in Billings, and the Community Crisis Center. These are facilities that tend to be very small and badly overcrowded. And that's not a good recipe in today's time. So if anybody can help, get out your checkbook. There's a lot of organizations that are going to need financial help. A lot of their funding has dropped off, or their funding comes from providing services for a fee, and they may not have been able to provide those services because they're responding to COVID-19. So that has a direct impact on their financial well-being. So we're looking to see what help can be given to our homeless population as well.
All right. As this continues to go on and you guys continue to have discussion, are there going to be some key indicators that you guys are going to be looking at to decide, okay, this is going to go on for another 2 weeks, this is going to go on for another 2 months, another 6 months? What are some of those discussions about, okay, if this happens, we're going to have to continue to do this, or if this happens, then we can really pull back on this?
I think from an administrative side of things, it really is that understanding of the data through those other communities and in our partnership with Riverstone Health to gauge just where are we in this process. And that, I think, it will be the long-term impact in understanding how do we keep 911 operating, police, fire. Fire stations run on 3 firefighters. So some of the most earliest things we've dealt with is trying to minimize their risk, because one firefighter, one station is diagnosed, and it has a pretty significant effect.
Sure.
What we're really focused on is, as you've heard, that flattening of the curve. We're very dependent upon our experts. This is far beyond the pay grade of Chris and I.
Absolutely.
But what they're saying is that this is going to get worse before it gets better. This is an exponential curve. 30–40% increase in other nations each day in the number of cases until these measures can take effect. That just takes time. But time is, we have time as long as our healthcare providers are not overwhelmed, as long as there aren't too many people in the ICUs, as long as too many people or healthcare providers don't get sick. So that's why it's important that all of us do our part to reduce those impacts, especially keeping our elderly and the most vulnerable with compromised respiratory systems or immune systems safe. We can weather this. We've got a great healthcare facility or facilities in Billings. We're very, very fortunate, but they can only handle so much. So that's the goal. Keep those numbers down, give it time, and we will weather this. We'll all be okay. We just have to hunker down. It's going to take a while.
Any discussions you guys have had about the fact that we do have we have several really good hospital facilities here in Billings, but those are regional facilities.
Absolutely.
And has that discussion been happening as far as, Billings may do okay, but regionally we're really going to be impacted?
We were at a news conference yesterday, and Chief Medical Officer of Billings Clinic, Bob Merchant, Dr. Bob Merchant, and Chief Medical Officer of St. Vincent, Dr. Michael Bush, were both stressing the need to support those regional healthcare facilities. If we can keep those people there, then they won't be in Billings, and hopefully that'll be the case. Of course, most people who get sick, it's relatively moderate. They do not go to the hospital. We don't want them to go to the hospital unless they need to be there. So that's the first thing. They're working with those regional facilities. If they come here for the most severe, they will be treated. But you're right, that's a very real problem.
Absolutely.
Or issue.
All right, Mayor Cole, any last words on the city's response to the pandemic?
Well, these are hard times. There's no doubt about that. But I have been very impressed by the response of our healthcare industry here locally, the individuals, our county health officer. We are in good hands. I've also been very impressed by Chris's leadership. He's been very collaborative and empowering for the department heads and our department employees. This is no job that can be done by one person. It takes a team, and Chris and others are doing a great job of marshaling all of our resources.
All right, Chris, any last words for us?
Well, for me, it's seeing what our citizens are doing. I mean, they really are stepping up, helping one another. These businesses that are being really decimated by the impact, those who are still open, who we can support, take out, drive-throughs, get out and do that, help those people survive
Absolutely.
this. So as we come out the other end of this, and we will, our economy and our community can recover more quickly. So.
All right. Well, Mayor Cole, Chris Kukolski for the City Administration, thank you so much for coming on and visiting with us today.
Thank you, Schutz.
Thank you so much for all you're doing for the community during this pandemic. I know it's a very stressful time for everyone, but I'm sure you guys feel the stress as much as or as more as anyone. So thank you for all your hard work during this time.
Thank you.
Thank you for the opportunity.